Okay, so my name is Juliette. I'm a medical student, third year at Southeastern University in Davie, Florida. And today I will be presenting a case report on a patient with primary cutaneous gamma delta T cell lymphoma. So a lot of us haven't heard about that because it's a very, very rare form of T cell lymphoma, of cutaneous T cell lymphoma. So before I begin the case presentation, I want to talk about the background. So T cell lymphomas and B cell lymphomas are a very rare type of cancer, right? And then we have an even more rare subcategory of that, which is the primary cutaneous gamma delta T cell lymphoma, or otherwise known as PCGDTCL. So that one has a frequency of less than 1% in the T cell lymphomas, and it has a very, very small survival rate. So our patient is a 48-year-old woman. She has a past medical history of Hashimoto's and a factor VII deficiency. She presents to the emergency department with a lot of ulcerations on the skin, night sweats, fatigue, fever, so a lot of cancer symptoms, plus the ulcerations on the skin. So first what we did was we did a histology, we did a lot of the pathology, and it came back positive for a lot of the perforin and granzymes, which we know are molecules released from cells that they induce target cell apoptosis. So she was basically, the cancer was, the cells were attacking her other cells in her body. She also has a history of, she is also diagnosed with hemophagocytic lymphohistiocytosis, which is an inflammatory syndrome. It could be genetic or it could also be acquired from disease. Hers was genetic, so she had the genes for it. And here in this case specifically, it's just another immune deficiency where there's a strong activation of the immune system, and it just attacks lymphocytes become overactive and attack the body rather than other organisms such as bacteria, viruses, things like that. So she has this HLH, and then she was diagnosed, unfortunately, with this cancer, very rare. So after we figured out it was the cancer through the bone marrow biopsy, we decided to treat her with CHOEP therapy. So this is what has been used previously for other gamma T cell lymphomas, and it has also been used. The HLH-94 protocol seen here in the intervention is something that is used for patients with HLH, specifically pediatric patients. So they decided to treat her with the CHOEP protocol, which is cyclophosphamide, doxorubicin, vincristine, etoposide, and prednisone, plus the HLH-94 protocol. So the first cycle, we finally administered it 4 months after the presentation of symptoms. She was also giving other medications because at one point she had neutropenia. So we gave her other medications. And then she was originally giving dexamethasone, which is a glucocorticoid, for her HLH, but that was replaced by etoposide due to side effects. On day 15, we reduced the doses of etoposide and vincristine. And then the most recent follow-up, which this is the most interesting part, which was 2 months after the first the first CT, we can see, especially down here, that, oh my goodness, that the cancer is basically mostly gone. So this was a PET CT scan, which was a very alarming, presentation. We're very glad that happened to her, but it was very rare that this happens to patients. So the prognosis is not usually favorable. We're very happy that this happened to her, but a lot of these patients go back they get the cancer back, so they leave remission in the next 3 months, pretty much. So the next step that we have for her is to get her a stem cell transplant. So we're working with her right now. That's the next step. I have to follow up with Memorial Healthcare, which is where she is getting treated. But yeah, this case presentation was just a very, you very rarely see in 2 months a patient who completely, all the skin tumors were gone for the most part, which was very cool.